Hi, welcome back to A Date with Darkness podcast. So because this is a two-part episode, I opted to not go with the intro this time, but I wanted to thank you very much for listening to the show. And of course, all the housekeeping information is down in the show notes, where it always is. And I love the fact that you're here, and I hope that you guys are still staying safe during the pandemic. So again, I brought a very lovely guest back today, Miss Quandra Chaffers, who is a licensed clinical social worker, a sex therapist, and also an EMDR instructor. And she is back today to talk about EMDR and what it is, when we use it, when it's most beneficial for clients, and what clients can expect from it, especially as you're healing from trauma and based on the severity of your trauma. She's going to give us some very helpful information about that. So stay tuned, and here is the interview with Quandra. Hello and welcome to the show, Quandra.
Thank you for having me back, Natalie.
I'm glad that you're back. Our last topic was, it was so enlightening, and I learned a lot from you. And I brought you back from another topic that, I'm familiar with, but not as familiar with as you. So I always learn from listening to you. But for the listeners who may not have heard the last show that we did together, can you talk a little bit about who you are, what you do, and what drives the passion behind your work?
For sure. So I am a private practitioner, sex therapist, and trauma specialist out here in San Francisco Bay Area. I work with survivors of sexual assault and their partner violence, lots of different traumas, and mostly people of color, but I like the nitty gritty. I like the complicated things and taking intersectional issues. So like what it is to be an immigrant and queer and struggling with depression, and making sure that we piece that apart. I walk people out of the stories of what's wrong with me into the stories of what happened to me. So away from things like I'm unlovable because I've been sexually abused, or that's what my ex told me, into that was just something that happened to me and I can have healthy relationships. What does healthy sexuality look like on the opposite end of this? So I've been doing this work for over 10 years now,
Nice.
at least pre-grad school. And I've had 10 years as a post-grad school licensed therapist. And I'm a ASEX certified sex educator and an EMDR certified therapist, approved consultant, and also now a facilitator in training with HAP, the Humanitarian Assistance Program.
Nice. Awesome. And I'm so excited for you. It sounds like you're doing a lot of great things for people. Yeah, this is amazing. I love it. And I can't wait to, we've talked and I told you that I'm definitely going to be working on that this year as part of my tool belt, getting an EMDR certification. But for folks that don't know, what is EMDR?
Yep. So EMDR stands for eye movement desensitization and reprocessing. And those are a lot of fancy words strung together to basically mean that we're triggering eye movements through something called bilateral stimulation to reprocess, that is, think through and make sense of the things that have happened to us, and desensitize it, that is, make it less impactful, less intense. And it's different than some of our traditional exposure therapies where people are just thrown into reliving the thing over and over again until it doesn't feel so bad. Because EMDR really rests on what's also called the adaptive information processing model,
Okay.
AIP model, where the key factor is that we're adding in new healthy information. Like, it's not just that the one person I thought I could trust that I opened up to about my childhood abuse then goes on to rape me, and it proves that I'm unlovable. We are introducing new information that I am in fact lovable, or that it wasn't my fault, or that, oh, I have resources now. You're introducing new information, like I can calm myself down through breathing skills and somatic response, and feel in the room in a way that I didn't when I was going through it. And a good therapist is going to be able to tie in all of those things as part of this full 8-phase technique. It's a 3-pronged approach, 8-phase technique. And what we mean by that is we are dealing with things that happened in the past, the present, and the future. Those are the 3 phases. In a true EMDR session is going to deal with triggers in the past, like the things that remind me of my rapist, things that came up in the present, like I got a text from him, and how do I want to deal with it in the future, the next time I see him in the streets. Stuff like, it's going to go through all 3 phases, past, present, and future. And it's going to go through an 8-phase protocol, starting with your therapist taking a detailed history, then preparing you to be able to talk about and work through the worst things in your life with skills like somatic work and mindfulness, taking an assessment that is specific to EMDR, where they're setting up a target, like we're going to work on this rape, and it's going to end with you being activated in that assessment, like I feel guilty or I feel scared like I did then. And then they're going to add in eye movements, or in whatever way or fashion they choose through bilateral stimulation. And that's the reprocessing phase. Then we go into the installation phase. You put in a new information, like, oh, I actually am safe now. And then you close and make sure that you put the person back together. So you might go through your mindfulness skills again, calm breathing, safe place, all the beautiful resources that we come with from our own cultures, like prayers and mantras, or like a hymn that my grandmother sang that calmed me down. You can use all of that between preparation phase through closure. And then you do a body scan to make sure that you also don't have anything left over when you leave the room with the therapist. Like, oh yeah, I feel pretty good, but it's just a little knot in my stomach. I don't know what that's about. They're gonna take care of that too. If we have the time and we do it correctly, you want to make sure that you're able to feel put together and not like you're falling apart when you're leaving the session. And phase 8 is when you come back, in case you didn't resolve it all in one go, perfectly fine. And phase 8 is where you talk about your insights since when you last were in this room with your therapist, and your dreams, or what's coming up for you, how you use your skills, and then you reprocess what's left.
That sounds amazing.
Yep.
That's amazing. What do we use EMDR for?
We can use it for a lot of things. Most likely people are going to process a trauma, and trauma is, we talk about big T traumas and little T traumas oftentimes in therapy, as you know, Natalie. And so a big T trauma is anything that your body believes is life-threatening, even if it's not. For instance, sexual assaults, people usually don't die from, but it's so invasive and so painful and so devaluing that your body treats it like anything else, like being robbed at gunpoint, or a car accident, or a hurricane. All of those things can be treated with EMDR, big T traumas, but you can also do little T traumas, things that really just rock the foundation of your world, like being told that you can't have children, or being fired from a job, grief and loss because you're going through a divorce, your spouse dies. And you can also treat ongoing traumatic stress. Like right now, we are living through a pandemic where every day
and
we're living through an acute awareness of the racism that's always been
Oh
there.
gosh,
So,
yeah.
it's always a new hashtag or a new trial regarding the latest police brutality or act against violence against the Asian community. All of those things can also be targeted with EMDR, even though there will be new instances of racism.
So that's good to know, and that's helpful for the listeners because for most of us who've been around in the game a long time, the psychotherapy game, when EMDR came out, it sounded very new, very innovative, but it also sounded like it was geared towards one color of folks, right? Specifically for white folks, right? And so when we talk about racialized based trauma, that makes me raise my eyebrows a little bit, like because now there's a segment for us too.
And we got to think about just kind of how that happens systemically, historically. Like our field of therapy is very white. Also, the founder, Francine Shapiro, is white, and she unfortunately passed away only 2 years
Yes.
ago. She was very open to this model being used in an anti-discriminatory way.
Okay.
Um, she but she used it on herself. She just was like walking along the street one day, realized that the back and forth movements of her feet was doing something to help her heal from her sexual assault. Then she started tracking something in front of her own eyes in a mirror and realized that it's helping, and decided something is working with this bilateral stimulation. So she fine-tuned it, and she graduated a bunch of friends and clinicians around her who happened to be white, and they became the first trainers. So then you get a a therapeutic organization that just happens to be steeped in whiteness. Then white people train other white people, and we're just now catching up because it's gained such national awareness that the more people who look like you and me
Right.
into our own communities, the more we recognize that this is a framework that can be easily adapted to
Right.
all communities of color, and um, be diversified.
That's amazing to hear that. And I'm curious to know about that too, because with people of color, there's so many layers of trauma, right? And so I'm curious to know in what way EMDR is geared specifically towards people of color. And it's not to say that other people don't have layers of trauma, but when we're talking about elements of like Black Lives Matter or
Yeah.
things like that, I mean, it's not just the current day Black Lives Matter that is traumatic, it's the layers of overt and covert racism that people go through every day. So I can see how Black Lives Matter could bring those things up, as well as George Floyd brutality and things like that, as well as post-traumatic slave syndrome and all those other things that are just very layered. So can you talk a little bit more about how EMDR can be used towards people of color?
Absolutely. So we know that trauma is intergenerational. For
Mhm.
instance, My Grandmother's Hands by Menachem, Resma Menachem,
Mm-hmm.
talks about Black bodies and white bodies and ways in which we've stored the energy of our ancestors. And, maybe my grandmother rocked in order to deal with her anxiety, and then she also is dealing with the rape that she never
Mm.
processed, or she saw her own parents go through domestic violence. And, so we can go back, and I can ask you to target your great grandparents' trauma the same way. And you have a felt sense of that in your DNA, in your genetics,
Mm.
because of epigenetics. And you have a learned sense of that by watching your family and how your community responds to racism or
Absolutely.
responds to intergenerational trauma like that. And so I've done like really powerful work trying to shed some of that and recognize like, oh, I had this people have the most beautiful insights, spiritual awakenings in EMDR of releasing some of those things that they don't need to carry. And then not passing it down in the womb in a way that's really felt. Like I and then I also think that, like with race-based trauma, you can still target the onslaught of what we're seeing in the news and what it was like to witness a verdict, not for Breonna Taylor, or not for the families, the surviving members of all of these people who were brutalized and murdered. And it's having a felt sense on you. Some of the things that Black and Brown clinicians also often ask me about, and in turn clients, is like, I'm very clear that, I'm not ugly, for instance. It's my employer's problem that they won't let me wear my locks or my cornrows, but it's still welling inside me and creating a lot of pain, distress, and anger, right? So typically in EMDR, you would target racism like that and ask the person, well, what does that say about you? And, maybe someone has internalized that to be like, I do go back to this time where I really felt ashamed of my hair, or couldn't wear it like the rest of the white girls in my class. And you would want to transition them into letting go of that internalized oppression by installing something better, like I'm beautiful. I bring something unique to this classroom with my Bantu knots or something. In the event that you haven't internalized the racism, you can still target the anger you feel about it. And maybe it's that, like, maybe it's not a neat opposite, like I'm ugly to I'm beautiful. Maybe the new information is that I can handle it, or I bring something of value to the world, or I can advocate for myself now. And that's the way I get over the fact that I was fired for not being willing to cut off my hair, or that I was unkempt. And EMDR can help you resource things that will help you to continue living with future racist experience.
How so?
So, like, going back to us targeting things in the past, the present, and the future.
Right.
After you've cleared out intergenerational trauma and internalized trauma and internalized racism or oppression, and present day triggers like maybe being fired or seeing a hashtag, you would also install, like, the next time somebody comes at me sideways about my hair, how am I going to see myself as excelling and overcoming in the face of that?
So would you say then, because that sounds very promising, the way you put that, it sounds like almost like it's like a guaranteed that you're going to recover, or that stuff's going to be cleared out, that space is going to be gone if this is successful.
Well, I like to think of it as, we do need to be mindful of our definition of success. So I have absolutely worked with people who have carried years and years of trauma. Sexually abused at age 5, and again at 7, and then first dating violence at 18, and horrible marriage from 23 to 25. And they're sitting in front of me now at 30 and saying, this is my first healthy relationship, or this is the first time ever in my life I can remember not having flashbacks. It's powerful. And you absolutely can have total success from like a scale of 10 to a 0. But in the realm of ongoing traumatic stress, like I live in a war zone, racism is still around. I don't think that we need to beat it over the head to be like, I'm at a 0 the next time. I have a racist experience, or the next time somebody is murdered in or hurt due to a rise in hate crimes, you you're not going to be like having a giddy reaction to those experiences. Like, you're likely to still feel upset, but the point is, can I respond in a way that it allows me to move on with my life, not be stuck in depression or anxiety um, or feeling disempowered about it. EMDR can maybe lower things from a 10 to like a 3 in a way that I can manage.
That's good. That's good to know. Is there a range in terms of sessions? If it's, severe versus, moderate amount of trauma versus mild trauma, like, for example, people who have layers upon layers of what you're talking about, as opposed to someone who perhaps got into a car accident and they're feeling a little bit skittish about getting back into a car.
Yeah, it depends. Like, if you've generally had a well adjusted life with not that many traumas, and the car accident is your first ever, uh, maybe you could clear that and come back down to being able to drive or exist in your world without anxiety and flashbacks within a couple of sessions. Sometimes EMDR works amazingly quickly, especially if you can draw on a bunch of resources and internal wisdoms that you've had across your life community. I've been amazed at how quickly EMDR works.
Sure.
And also experienced it for myself. That's what made me a believer, So part of training as a therapist is that we practice on each other. So when I resolved some grief I was carrying really quickly, I was just in awe. And that only took one session in someone new who hadn't known me before. And even with all of the complex trauma, sexual abuse all through my lifetime, horrible relationships up until now, you might resolve that in a couple of sessions to a handful of sessions, because again, with it being that we're introducing new important material, maybe it's a domino effect where the through line through all of it, it was my fault.
Wow.
Or I don't deserve anything better. So when it clicks in a felt way and it makes sense across your whole brain, your whole network of these memories, you don't have to go through each and every trauma. It tends to have this generalizing effect. And that's how it can sometimes work, especially quickly on things that people have been struggling with for decades.
Okay, that sounds amazing. What types of trauma can we use EMDR for? Or perhaps what better question is, perhaps when should we seek out EMDR versus something else, versus like talk therapy, versus like DBT or CBT, or when should one seek out EMDR?
Yeah, and I do a lot of those other therapies too, like CBT. Sometimes I interchange them still. And I think some of it has to do with being person-centered, what works for the person. Like I've worked with poets and writers and speakers who love narrative work. And there's a lot of power you can do with shaping the narrative, the story of what happened to you. That may also be very valuable. You could target the same things through EMDR. So sometimes it's just about what works for the person. For a lot of people, they come to EMDR because they've tried all those other things. They've been in talk therapy for years. They've done CBT. They know how to address their negative thought process, but their body is still holding on to this in a felt way. Like when I bring up this car accident, I still feel like pain in my pelvis, even though I've gone through the surgery and it's healed. Or, I still can kind of see my attacker, or I feel like I'm 11 again and I don't know how to stand up to my dad. Those things aren't solved through just cognitive behavioral therapy and changing a belief system like I can't trust anybody. It has to be, how do you target these ways in which it is stored in my body, in my genetics, in my cells, and combine it at the same time with information like I'm safe or I can help people. I think EMDR is great when you've tried a lot of those other things. I think DBT is important first for people who aren't stable. Like DBT is also often a treatment that we advise people to take if they're struggling with bipolar disorder or borderline personality disorder, and they're actively suicidal. You need to be able to use some skills enough to bring up the worst experiences of your life and not threaten to kill yourself or harm someone else. It may be counterproductive to do EMDR without some skills if you're actively using substances or in a danger, like if you're like, some people like to do a certain amount of harm reduction first to make sure that you're not like actively escaping domestic violence. Like maybe you'll do it at a shelter or do it once you're, even though other people may work with ongoing traumatic stress and you can do a lot of good while still in an abusive situation, but your therapist may weigh some of those things. And also, I think EMDR is not good to do if you're trying to target things that are medically based or degenerative. Like, say if grandma is struggling with dementia and she's on the decline and she's starting to be like more easily irritable or angry, and the grandchildren are trying to deal with that anger. EMDR can't solve your grandmother's dementia. It's a medical condition. But it can help the surviving members. Like, what does it mean to you as a grandchild? It means that I'm helpless. I can't take care of the ones I love. It means I should have done more. EMDR can work with that stuff as a caregiver in response to that person.
Makes a lot of sense. And I think I had talked with you about this before, about whether or not it can be used with psychosis, such as schizophrenia. And I heard you mention that, with degenerative disorders, and I know that in some cases, schizophrenia is degenerative. So there's been, some talk about it should not be used with that. I don't know if you have some differing views about that.
Yeah, I had seen a study that's showed work of EMDR with psychosis, and it does seem to still lower distress on some.
Interesting.
So, there's times where people are lucid, even with schizophrenia, and you're going to target something like divorce because your spouse can't deal with it. That would be fine.
Yeah.
Or maybe somebody comes in active in psychosis and they think the aliens are trying to take over their brain. Apparently, some EMDR therapists may use EMDR to try and help with the fear and target that belief the same way, although others will stay away from delusions like that, false beliefs, because we're afraid of intensifying them, or they're not really going to go away because schizophrenia just gets worse over time. We can't, EMDR can't take away the delusions. They can maybe help with the distress or the response to those delusions. And the part of the brain that works on flashbacks and is also the part of the brain that is responsible for hallucinations and delusions. So, there seems to also be some evidence that the same way we would target a big T trauma, like surviving a tornado, that area of the brain is equally affected if we were to target that you feel scared because you think people are out to get you.
That's very interesting and good to know. Is there a fixed number of sessions? Because it's my understanding that EMDR is supposed to be very short term. Is there a fixed number of sessions that people need in order to sort of resolve their issues?
Also complicated. So what most likely is going to happen is some people might try and seek out EMDR through their insurance, and insurances will, of course, be like, as you well know, Natalie.
Yeah.
They will tell us how many sessions they think it takes through EMDR, and it's not always the case. So you might be working with that. I've also met some people who've been given Loveland vouchers and may only have 4 vouchers or 10 vouchers from a community clinic to do it. And within whatever amount of sessions you're allotted, because that's what is within your method of paying, you can probably get a lot done. but within that, your therapist is going to have to be judicial, because if you only have 4 sessions or 10 sessions, maybe we don't want to do 5 years of moving through a refugee camp. Maybe we want to just target the really mean looks that the ICE professional official gave you when they were arresting you. Maybe we want to just target one aspect of this really big complicated thing in immigration.
Yeah.
And then help you, and also we may want to prioritize what's going to help you get most back to a semblance of living. So sometimes you'll work with that if you have a limited amount of sessions, but I've certainly worked with people doing EMDR for a couple of years, just clearing out different clusters of horrible things that have happened to you.
Nice. And once it's gone, it's gone.
Yeah. And, it's one of the reasons I love doing trauma work, because unlike a degenerative disorder like schizophrenia, trauma is not something you have to live with.
Yeah.
And really believe that you're deserving of love. Like, think about it. If before, through the first 30 years of your life, you really didn't believe that, what you think about what that does the next time you're faced with a tragedy or a hardship. You take that information and you apply it differently, or you're able to weed out people that you used to be attracted to. And in that way, yes, it's very much gone. And I love having seen those success stories and held space for people who are like, thank you so much. This is like the first time in my life that I was able to ask for what I needed from my partner and know that they weren't going to leave me. This is the first time that I haven't had a nightmare in 2 weeks, and it's amazing. Or, just like, I really believe this isn't my fault and I can move forward.
Good enough. Thank you for that. And that's very refreshing to hear. And I think that'll make a lot of people hopeful just hearing that. I'm curious to know what your thoughts are in terms of EMDR professionals. So, as we were talking about before, Black Lives Matter, immigration trauma, things like that. When we're talking about using EMDR for very culture or ethnic specific traumas, should we be seeking out a professional that is very well versed in speaking to those traumas, or is it just enough to find someone who has it? Is it just enough to find a professional who's trained in EMDR?
Yes, it's not enough to just find someone supposedly trained. And also, unfortunately, there's trainings out there from people who may have taken an EMDR trainer, but they're going through a non-official, they're going through a non-EMDRIA approved course like PESI or something like that. Or they're taking really big liberties and they're not really practicing the material. And so all of that can be very worrisome and confusing, but the main things are like, you should look on EMDRIA's website.
Okay.
Is the certifying body, EMDRIA.org, and the IA is the International Association. And they have a directory of people who have finished at least basic training, have paid their dues, and therefore EMDRIA, the body, can verify that they turned in all their hours to get proper consultation and know what they're doing. You can look by state and by specialty, including race-based trauma, but you can't really search by ethnicity or race. You'll have to kind of take your best guess. And then you have to find people licensed in your area. So if in your area there's not someone of color, them's the breaks, but you might still be able to vet through some of those clinicians to make sure that they are comfortable bringing up culture into the room, that they've worked with race before, if that's an important part of your healing. And I truly believe that we can't do therapy without looking at the whole person. I always bring culture and race and backgrounds into the room. It's also important not to just mine your race for poor things that have happened to you. Being Black isn't just hashtags and trauma. It's joy, and it's music, and it's great intellect, and long histories dating back to powerful empires. And the same way we might target some sort of internalized intergenerational trauma from slavery or from your grandparents' intimate partner violence, I might use intergenerational resources from kings and queens before you, and Martin Luther King and Coretta Scott, and from Harriet Tubman, or other people who are empowered in this work of surviving, because there's strength in everybody's community. So hopefully you should find someone who will look to you about what can they bring into the room that's going to feel most true to you. Like this prayer, this hymn, this mudra, this mindfulness technique, my yoga, my picture of me and my family, my locket, my exercise routine, whatever it is that really is powerful to your healing should be intrinsic and unique to your work in EMDR as well.
Amazing. Thank you so much for doing that. And, one of the things I'm curious about, because it's the eye movement, the reprocessing, and I know that there's, sometimes they could be using tapping and the light. Can EMDR be done over telehealth?
Yeah, and so we were kind of forced to see if EMDR can be done through telehealth. There were people who were doing it before the pandemic, and EMDRIA had to take a stance very quickly, and mostly we're seeing this exact same results as if we were in person. So I started out by saying how Francine Shapiro just stumbled upon it by walking, right? So the first bilateral stimulation was tactile. It was movement. It was her taking a walk through the park, left foot, right foot, left foot, right foot, and then realizing that her eyes naturally move back and forth. Then she had something in front of her face. And from there, your viewers won't be able to see me, but we basically like hold up our first two fingers like a Hunger Games sign, and move it back and forth in a straight line in front of people's eyes. And we can do that on a screen as well. Your clinician may move out the way of the screen, so you're just seeing their fingers go to the peripheral of your laptop screen. Or they may introduce you to an app that facilitates it, like Remote EMDR or some other kind of app that makes a bouncing dot go across the screen. I am one of the clinicians who goes by the camp. It's not okay to just buy an EMDR app on your own and then watch a bouncing dot.
I agree.
As we've talked about, part of EMDR is a whole modality, requires that someone is reflecting back to you exactly what's coming up for you in your particular history, your particular trauma, and helping guide you and ground you and go through all of those 8 phases. And you're not going to do that. You're not going to be able to do that just by thinking about your trauma, watching a dot for a bit, and then hoping to calm down, because it's about new information and having a safe, supportive relationship and a therapist help you navigate those new informations and help keep you together in case your brain goes off the rails and starts doing what we're calling flooding with a bunch of this new material. So going back again, telehealth. Another thing is butterfly hugs, which is self-tapping. So if I tap the right side of my shoulder with my right hand and the left side of my shoulder with my left hand, you know, I'm stimulating the opposite side of my brain. So the right hand is stimulating my left brain and my left hand is stimulating my right brain. And that's just because our brains are crisscrossed like that. So if I tap back and forth one at a time, I start helping my brain stimulate both sides of it at the same time, in addition to the talk therapy we're already doing. And we find that butterfly hugs are mobile. It's really important to disaster zones and communities that may not have computers or a lot of resources. Maybe you want to do this on the ground in a concentration camp or something like that. Thankfully, we can all tap everywhere we go. So there is something to being able to show someone tapping back and across their chest or on their shoulders back and forth in a hug. And it's going to work just as well as if you were tracking something with a laser, a light bar, or a bouncing dot. What's important is to think about what is available to the person and what is also comfortable and available to that person to do. For instance, if you have a disability and you can't grab your shoulder because of shoulder injuries, we're obviously not going to tap that way. If you have astigmatism that's very heavy or some sort of eye injury or you're blind, you're not going to be able to track a light bar, obviously, but maybe you can listen to audio. And that's the beauty of having headphones in on some of these apps. It will alternate tones in one ear or the other. Or if you were in person, you know, a therapist could go behind you and snap in either ear.
Nice.
Or you could join a drum circle and take on some cultural methods of healings and like pat back and forth or bang a conga back and forth. Those things are also really great in play therapy with kids.
Nice. There's so many different little nuances that I didn't know about. So this is refreshing to hear about that, you know, even if you have a disability or even if you're not able to do certain elements, there's other ways in which this treatment can certainly be accommodating. And that's one of the things I love, you know, about therapy or psychology is that we can always just sort of accommodate and acclimate, you know, make things, you know, just sort of, I don't know, make it to fit us the way we need it to. So that's really refreshing to hear. So that's really exciting. And I'm excited to take my training in the EMDR. So I can't wait till I get to the level where you are, of course. I love it. I love it. So, you know, as we wrap up, And I'm glad that the other piece, the last piece I will say that I'm glad you brought up, is because, with being a therapist, therapy is so versatile. But I also think that there's all these little nuances that come up that always sort of annoy me about, people sort of getting life coaching or getting this other avenue that's not really the same. And so I'm glad that you mentioned that doing it on yourself is something that you kind of shy away from, because I have seen an influx of books and things on Amazon is, basically do EMDR on yourself.
Right. And so it's like bilateral stimulation, just watching something in front of your eyes or tapping back and forth. It can have a lot of benefits to learning to like decrease symptoms. Like it's a self-soothing skill, the same way I might hum to myself
Sure.
or do calm breathing. And
Sure.
a lot of people are adapting BLS just to learn to manage their symptoms
Mm-hmm.
day to day. That's not so bad, but you cannot fully address your trauma in a safe way without the help of a trained EMDR therapist and a professional. And that's the difference. Um, Formerly, I used to work with like foster care youth and youth who teenagers who've been sexually abused through a sexual assault clinic. And like if I'd go and support them at a family courts hearing or a trial, the courts loved letting kids butterfly hug and tap on themselves in between sessions. It's really a great self-soothing strategy just to be able to go up and then recount your story again to the latest advocate or detective or something like that. But it's still not the substitute for continuing to do therapy with me
Absolutely.
and us making sure you stop having flashbacks or night terrors or regressing and
Yeah.
being able to find trust with and not act out with
Yeah.
your new safer family or foster family.
Absolutely. So, yeah, I think that's an excellent point and an excellent way to end is that, you can't substitute therapy. You got to do the real deal in order to get the full benefit. So, I appreciate you for saying that. Um, any last tips or recommendations you want to give for EMDR? And then tell us, of course, where to find you.
Yeah, EMDR is amazing and it's not always a cure all. It can be that your complex trauma resolves relatively quickly, a few sessions, and it may take a couple of years, especially if people have a lot of things going on, like a lot of different disorders, mood disorders,
Mhm.
dissociation, um, new traumas that are popping up. But I do this work because I've seen people get better. I know the power of this modality.
Mm,
Um, and then also, besides going through insurance, if you find someone who you think you may gel with because they're a person of color or they have the background you need, maybe reach out anyway, even if it's out of pocket, to a therapist who's taking clients and see if you can negotiate for some sort of sliding scale or use some other avenue like an HSA account through your work or get reimbursed through your medical insurance for partially what you paid to that professional. There's a lot of ways to find affordable therapy. So yes, I myself am not taking new clients at the moment. I'm frequently full, but I know people who are because I'm training a lot of new brilliant consultees.
nice. I can't wait for you to train me.
Yes, I will have the room. And so you all can find me at www.sastherapy.com or
Mhm.
email me Quandra, my first name at sastherapy.com. That's snake apple snake therapy.com. And I'm also on IG and Twitter, but don't leave me anything too saucy about what's
Yeah,
going on in your life for the sake of confidentiality. I won't be responding in front of everybody, the whole world.
sure.
Um, and I am happy to point people in the right directions. of where to find care and good work.
Thank you so much for that. And lastly, do you have anything coming up for you, like any sort of major projects or things like that we can support you on?
Yeah, certainly. So, like in the realm of EMDR, if there's any clinicians who want to go through training, um, there's several all persons of color and Black trainings that I support, including MEND is a non-for-profit who has been trying to get clinicians of color trained in these modalities.
And that's MEN?
MEND.
Okay.
And also, I have a group for therapists of color who want consultation services. But since I think most of your listeners are general clients and are just interested in what's happening in the world, they can always stay abreast of what I've got going on and follow my blog at my website.
Okay.
And I try to give helpful information on several things regarding sexuality and trauma work there.
Okay, awesome. Thank you so much, Quandra. I really appreciate you taking the time being on the show.
Thank you, Natalie.
Awesome. All right, so you've heard my interview with Quandra. I'd love to know what your thoughts were about this interview. What are your thoughts on EMDR? Have you had it, or is it something that you want to try? Do you think it might be beneficial for you? I just love to hear what your thoughts are. And so I'm signing off, but I appreciate you hanging out with us. And until next time, take care of yourselves and be well.